Okay, so now we're recording. So I will. Oh, hold on a second. I'm gonna go. So when so we're going to. I think. You know what? I'm gonna start again. Okay. Welcome everybody. Thank you so much for. Thank you so much for joining us for the second in a three-part series. We have with us Deena Elias, that if you did not get her bio, then you could actually watch the earlier recording, because I don't want to waste the time, because we wanted every minute last time. And just wait to remind you, the way that we're going to work this is that if you have any questions, then feel free to put it into the chat. You could private message me in the chat. If you have my WhatsApp, you could do that too. I'll check that also every so often. And you could also you could chat privately, you could chat to everybody, and we will look forward to hearing from you. This is, again, a second and a third part series. We are recorded, just to let you know, because it's important to let people know that. Next week, I'm going to share a little bit at the end of this class. I'll share a little bit of what we're going to be doing next week. And next week is going to be a little bit more of the interface between the things that Deena is teaching and Halacha, or the questions that I get as Yoetzet Halacha, and some of the important things to know from a Halachic perspective or from a Jewish practice perspective that I've encountered over the years, and that other people have encountered. So, Deena, take it away, please.
Thank you so much. And once again, Atara and everybody here, I'm really grateful that you all took the time out. I know these nights are not easy. So I thank you for coming, and I hope that everyone could take at least one thing from some of these classes. So today's talk is going to be kind of, last time we talked about kind of adolescent through adulthood, kind of right up until pregnancy or motherhood. Today we're going to start at pregnancy, but I want to preface this by saying, even if you're not in that, you know what they say, like in that parsha, if you're not in that realm of pregnancy and childbirth, some of the things I talk about in pregnancy might actually be helpful if you went through something like that when you were pregnant, because if you have or had any of these types of challenges and never addressed them, they could come back to haunt you a little bit later in life. So it's really important to be aware of what happened when you were pregnant, when you had a baby, what might have been a challenge in that time, and what might be lingering afterwards in your body. And then we'll go from pregnancy, we'll go into just like kind of everyday challenges as a mother, as a woman. And then we'll go from there into like kind of older adulthood, all the way through menopause and beyond, just regular aging adults. So I'm going to share my screen, and nope, push the button. Here we go. Okay, so let me just get it big where we left off. Sorry, when I make it big, it has to go from the beginning for some reason. Going through, this is just what, quick, really fast review of what we did last time. Okay, saw these neck pain pictures, headaches, the core, which we'll talk more about the core today. Also,
This is a good little review. It is a good little review.
Yeah, quick little trip down memory lane. Right, we talked about the hip hinging and lifting and carrying, and that's going to really come in play with the baby lifting, right? Always want to hinge from your hips, not, oh, this is a squat, but hinge from your hips and not from your back. No rounding when you're picking up that baby, but we'll get to that again. Okay, here we go. Okay, so pregnancy. So first, in order to learn about pregnancy and challenges, we have to know, oh no, what just happened? I am sorry. It just exited. No. Oh, okay, we're good. Okay, I'm trying to just move this bar away so I can see the words. Okay, so we have to learn about what happens in pregnancy in order to know why we have a lot of these common issues during pregnancy, during birth, and beyond. So first of all, when we talk about changes to our body, there's kind of different layers of it. There's postural, just physical, like musculoskeletal changes that go on in our body. And then there's also hormonal changes that happen. So quickly about the hormonal changes, we have a lot of different hormonal changes that happen, but one of them that relates to kind of the musculoskeletal system is an increase in the hormone called relaxin. Now, relaxin is a very important hormone in pregnancy because what it does is it kind of, like the name, it relaxes your ligaments in your body, and specifically in the pelvic region, in order for the pelvis to kind of open up and widen to allow for childbirth. So that is obviously very important in pregnancy, and we need our bodies to be able to adapt and grow and move and kind of shift with a growing baby and for childbirth. But unfortunately, that kind of leaves us as the host of this baby a little bit vulnerable, okay? Because what ligaments do is they're like tight elastic bands, and they usually just kind of hold your bones. They attach from bone to bone, and that's where your ligaments are. So they kind of hold your bones in place and your joints in place where they should be. And when they're not doing their job, when they're a little bit too loose and too relaxed, it could leave your bones and your joints a little bit vulnerable to injury or muscle strain, or just kind of tweaking of alignment and things like that. So that is, that's kind of the issue with the relaxin increase. Now, that's not to say that because every person who is pregnant has an increase in relaxin, and therefore every single pregnant woman is going to have pain. But what it does is it kind of sets up the body for potential problems. And really, when we have pain is when one side of the body is doing something asymmetrical to the other side of the body. So, just because everything is loose doesn't mean you're automatically going to have pain. But if let's say one side of your pelvis is shifted a little bit forward and the other isn't, that's when you're going to start to feel that pain, either right at like the bottom of your sacrum, or like your low back, or in the front by the pubic bone. We'll get into all that. The other thing that's really important to realize is that our entire posture changes, and without us, purposely doing it, when we're pregnant, we get kind of this, that kind of exaggerated, like our chest sticks out, our backside sticks out, and then we have a large curve in our lower back. And normally our low back is supposed to have a curve, but in pregnancy, it just gets very exaggerated, which you can see here, right? This is normal. We normally have a curve here, a curve here, a curve here, but then as the pregnancy progresses, that curve gets really exaggerated. And as you can see, that can cause some pinching of some nerves, which a lot of times is what leads to that sciatica, which is basically, like we mentioned, it's just a pinching of the sciatic nerve, which then goes down the back of the leg. You feel that pain. It could lead to some disc herniations because of, the extreme angle that these discs are, that the vertebrae are at, squeezing the discs out. And then besides for which, it's also adding a lot of load to your pelvis and to, your lower back. So in addition to just that physical curve change, we also have, a lot of the issue just with the increase in breast size, which then causes kind of that hunched over, you see like this curve also gets a little bit bigger just to like support your chest physically. So we get sometimes people can get neck, upper body, or neck pain with that. Obviously our abdominal muscles get overstretched and weak, as well as your pelvic floor muscles get very overstretched and weak. And a lot of times we have what's called, every time when you're pregnant, you get what's called rib flare. I think we touched on this a little bit last time, but we're going to spend a little more time on it this time. Basically, what rib flare is you see this is a normal skeleton, okay? And the red represents the diaphragm. we talked about this last time. I'm going to review it because it's a little sometimes confusing, but a really important message about breathing and your core. So a normal diaphragm is supposed to be this nice kind of hook-shaped dome, okay? And it's a muscle, just like any other muscle. So when this muscle contracts, though, what it does is it pulls down, okay? So it goes kind of like in opposite, it makes a U instead of this upside down U, okay?
Deena, I'm going to interrupt for 1 second. That I find this, so again, like when I was going over this with Deena beforehand, we did a lot of show and tell. And I would really super recommend that you like take your hands and like physically feel where these things are in your body when possible. And then when Deena mentions like practicing things, then if you, I love having your camera on. I think having your camera on makes the experience better for everybody if you can. But I would also super recommend that if you feel funny doing these things with the camera on, turn the camera off and do it. It really makes a big difference, and you'll also remember it better. Like when you perform these things, then you develop the muscle memory to remember how to do it. So I'm gonna put on my educator hat and say, the more that you practice, the more that you do it. So don't let it say it's practice. Turn off your camera and do it if you feel funny doing it in front of the camera.
Yes, thank you for that plug. Appreciate that. Yeah, so as I was saying, so the diaphragm connects under the rib cage, okay? So why is this important? So basically when we're pregnant, right, because our chest is being flared out, our ribs get flared out. So instead of them being nice and straight and down, all of a sudden our rib angle is all the way out here. And what that does is it pulls on the diaphragm underneath. So instead of having this nice domed shaped diaphragm, which when it contracts, it'll come down and come right back up and come down and come up. Now all of a sudden it's pulling on the diaphragm and it's flattening it out, which causes the diaphragm to not work so well, okay? And there'll be a diagram in the next slide, I think, but this is a good image too, because you really see that flattening versus the roundingness. And so that's why when we're pregnant, first of all, we get a shortness of breath. It's not always just the baby shoving up against our lungs, which that is too, but also physically the muscle that controls breathing, which is your diaphragm, is just not operating the way it should be, okay? So just keep that in mind for a minute because we're gonna come back to that. Click. There we go. Okay, so common pregnancy challenges. So what are some of the problems that I see a lot as a physical therapist with women who are pregnant? Like we mentioned, back pain, neck pain, kind of that musculoskeletal pain of just physical, like tightness of muscles, because whenever our curve is, too much this way, we're going to get tightness in the neck muscles here. And then what's going to happen on the opposite side is that a lot of, like, if we have an exaggerated curve in our lower back, on the opposite side of that, and the abdominals, we're going to have a stretching out and a weakness here, okay? The same thing here. When we're kind of hunched over, our pec muscles are going to get super tight, and our shoulders, and that can pull down here and make a lot of pain here because of the excess weight in the chest. And the opposite, everything has a reaction. So because this is getting pulled in tight, our upper back muscles are getting stretched out and weak and loose, and that's not good either. Sometimes people have tight hip flexors because of this, and weak glutes. So it could really cause a whole host of just muscle strains and pains. And then also we can get sometimes, like I said, that shifting of the pelvis can sometimes cause pelvic girdle pain, which is basically any pain around the pelvis. The pelvis is a ring like this, okay? It's a 3D ring, circle around your pelvic floor muscles sit inside. And basically, whenever the ligaments that connect these bones together and these bones together, and ligaments connect these bones together, you just don't see them in this picture, but they're there. When they're too loose, this kind of shifts and glides a little too much and can end up causing pain in the back, like right in like the upper like butt region, when you just have one finger like right there, that's where it hurts. That's called the sacroiliac joint, okay? That's this joint. You have pain back there. Sometimes people get pain right in the front in the pubic symphysis, and the pubic symphysis disorder is kind of a more extreme case which is when it actually separates a little bit in the front. Those two bones separate, and that can cause a lot of pain with like stair climbing and walking and things like that. And I've seen plenty of women with that too. My heart goes out to them because it's very painful. So let's also talk a little bit about pelvic floor issues that happen in pregnancy. So this is why I was prefacing with all that diaphragm talk and the rib flare. So as we mentioned in the last class, our core is made up of, it's not just your stomach muscles, it's a 3D canister, okay? Think of a Pringles can. The top of your core is your diaphragm. The bottom of your core is your pelvic floor. The front are your abdominal muscles and the back is your back muscles, okay? So that's the canister. And everything works together and at the same time. This is a person breathing, okay? When we inhale, our diaphragm pulls down. So this is the down position, that's an inhale, in order to allow for a lot more air and your lungs to expand up here. At the same time that this is being pulled down, your pelvic floor muscles are being stretched out and relaxed, or should be, I should say, okay? And at the same time that we're inhaling, our belly should be expanding and our back should be expanding, although it's not in this picture, okay? Every time we exhale, the opposite happens. Our diaphragm is supposed to spring back up, push the air up and out of our lungs, right? Our pelvic floor is supposed to give a little bit of support. So it's supposed to actually contract. When it's down, it's relaxed. When it's up, it's contracted. It's doing tight muscle, okay? So when you exhale, your pelvic floor should work a little bit. And if you're very in tune with your body and being able to kind of feel what's going on in your body, if you do a heavy exhale or like a little cough, you should be able to feel your pelvic floor muscles on the inside giving a little bit of a tightening, okay? Or they should be, I should say.
This is one of those things that you should try. Like
Everyone
I would say, try it right now. Feel it. Like if, like feel it.
A little bit of a, do you feel your pelvic floor muscles? And if you don't know what pelvic floor muscles are, it's the inner muscles surrounding your vagina, your urethra, and your rectum, okay? So if you should feel a little bit of a kind of a jolt, a little pull up of those muscles, okay? That's just to get you in tune with where those muscles are, what they should feel like when they're working, okay? So back to our newly pregnant person who doesn't have much changes going on yet in terms of, you know, shape and size. Basically, every time you exhale, this pelvic floor should go up and our core should contract and our diaphragm should go up, okay? What happens as the pregnancy progresses, right? Everything starts to stretch out and stretch out even more, okay? So now this woman has that rib flare that we were talking about, which is causing her diaphragm to flatten out. So it's no more this nice domed shape. Now it's almost looking more like a pancake. And if you notice, her pelvic floor is doing the same thing. It's stretching all the way out. It's not getting this nice contraction and relaxation. It's kind of just there, right? It's like barely holding on here. And so therefore the excursion, look how high this diaphragm goes and this pelvic floor goes and how high and how low it goes. The excursion is much less on this one, right? This one, it's just barely going up and barely going down. So no wonder we feel out of breath after going up 5 steps, right? And no wonder we sometimes we leak urine when we're in that later stages of pregnancy or after pregnancy when it's still kind of stretched out and has never, you know, kind of fully gone back yet until you work on it and get it back, or until just time heals it and it starts to strengthen up again. Also, another reason why we feel like we have to run to the bathroom every 5 minutes, our pelvic floor is just not holding in the urine like it should do. You know, it causes, besides for, you know, babysitting on my bladder, that doesn't help. And all the extra fluid in your body, that doesn't help. But it's just another thing, another cause for that kind of incontinence in pregnancy and postpartum, okay? So besides for, you know, the breathing and the incontinence, we also have other possible issues with our pelvic floor during pregnancy. So we mentioned the urge and the weakness. Prolapse, I'll just mention real quickly, is basically when, you know what, I'm going to save prolapse for another picture that I have that's just much more better. So we'll come back to prolapse. Okay, so that was pregnancy. Now we're moving past that. You know, there are things we can work on in pregnancy. People a lot of times ask me, what could I do to prepare for birth? Okay, and I am not a doula and I'm not a midwife. So I'm not, and you know, for my personal experiences, I had an epidural, you know, I'm not like, you know, I'm not the expert on labor positioning and techniques and things like that. However, I will say that it is very important to be, no matter what kind of birth you're planning for or, you know, think you want to have, it's important to keep your body mobile, okay? Meaning, some people say, you know, I want to be able to, you know, move around and get in different positions during labor. And, you know, my doula or my midwife said, I'm going to go on hands and knees and I'm going to go on a ball and I'm going to squat and do all these things in birth. But if you've been kind of stationary for most of your pregnancy, or for at least for the end of your the end of your pregnancy, you're not going to want to be in those crazy positions during labor. Your body is going to be very stiff and it's not going to feel good doing any of those kind of positions. Besides for the fact that these types of mobility exercises actually do help to kind of open the pelvis a little bit and just relax your lower back a little bit, get things moving in there, just to make the less stiff your back is and the less stiff your pelvis is, the better off you are going into birth. So I'll just, you know, I'm just leaving these pictures here. You can always, if this is something you want to work on, or if you are pregnant, or if you know someone who's pregnant and could benefit from these exercises and want more instructions, please feel free to email me. I'm happy to give the full instructions for these exercises, but I just wanted to put this out there in terms of actual birth preparation, about increasing mobility in your lower body. And then a word about the peanut ball. This I did use in my labor. Peanut ball during labor, all you do is this, you just sit with it. You just keep it with you. You bring it with you to the hospital. And it just, all it does is it keeps your pelvis a little bit more open during the long hours of labor. And for me, it helped. I don't know if it was only that or that and a bunch of other things that helped, but it definitely helped. So just a little plug for the peanut ball, because it's something I didn't know about existed before my third child, and I was very happy to use it for my third child. So just, that's the peanut ball. Okay.
We're not going to make somebody who's theoretically very pregnant right now demonstrate all of these, right?
Right. I mean, they're welcome to if they'd like to, but I'm also happy to privately do that with you as well. And I can't see anyone on here, so I don't even know who you're talking about. Okay. Okay, so moving on to, so you had the baby, thank God, all is well. But now, you know, it's funny how we have so many classes for birthing classes and, you know, all these books on what to expect when you're expecting and what to expect the first year and what to, you know, all these baby classes and, you know, all these books about, you know, parenting and the right types of cribs and 100 websites on what stroller is best for your baby. But there's not so much information, if any information out there for like, what about you? Like what happens to you day one through year one after you've had that baby, right? You're just kind of expected to bounce back, which is the most ludicrous term when you think about it. Right after you had a baby, no one's bouncing, right? It's just not a motion you're doing. So nobody, you know, people expect you to bounce back and expect you to just jump right into mom zone and running to carpools and picking up your toddlers and all that. But sometimes our bodies are just not ready for it. And we don't know how to get to it. I like talking about postpartum also because a lot of times women want to get right back to exercise and they don't know how, or they don't know how much they can push themselves, or they don't know, you know, or they, you know, either they do too much too soon, so they'll jump right back to their like CrossFit gym exercises, or the opposite, they'll feel really, really cautious and really scared that they're going to hurt themselves. So they kind of do nothing and they just stay really stiff and still and don't do enough, just because maybe they have, a pelvic floor issue and they don't want to, they don't want to pee when they're trying to squat, or they have this splitting of the abs and they don't want to make it worse. So they're just overly cautious because they don't want to hurt themselves, but, then they are hurting themselves more by not moving. So, another plug for PT, or there are actually fitness coaches out there that are very trained in postpartum knowledge. So that exists too. So I definitely would say, don't wait to seek help and don't stay too still. So here are some common postpartum challenges that I treat very often. This is just a couple of them that are like kind of the most common. Diastasis recti is basically when we're pregnant, or really this could happen to a man. It could happen to any time there's like any reason for the abdomen to grow or protrude. The tissue between, this is a muscle called the rectus abdominis. It's that muscle that would cause like a six pack, right? And what happens is there's this tissue in the middle of it. And during pregnancy, that tissue gets stretched out and weak and overly stretched out. And then after we give birth, it doesn't just kind of spring back together. It doesn't work like that. So normally it takes about 6 to 8 weeks for it to get back to somewhere close to this. But it's important to note that after 8 weeks, these muscles will not go back to their normal self on their own. Whatever you get at the end of that 2 months postpartum, that's where you're at, unless you intervene. So I've seen women 5, 10, yeah.
So when you say it goes back on their own, meaning that for what
normal
percentage of women,
healing.
Like what percentage of women do you find that like after the 8 weeks, the muscles pretty much go back? And how common is it that, as you're going to address, that years, decades later?
I don't have the exact stat on that. I could look that up for you, the exact percentage of women. But just from my own personal experience giving these kinds of classes, like I give these postpartum group Zoom classes, and I would say about 25% have some form of diastasis, even beyond the 8 weeks, a significant diastasis, which diastasis just literally means splitting. A significant diastasis has to be 2 finger widths in width, okay, and kind of deep and squishy, okay. So, for the most part, it goes back on its own, especially if you're an active individual, if you were active before, if you had a strong core before, if you kind of exercised and did some core work during your pregnancy, and then, you start working on it when it's safe to afterwards. I would say most women, it does go back, but I would say a good, about 25% of the women that I see in these postpartum classes that are not just geared to people with this problem, they're geared to all postpartum women, do still have this, and it will stay there. It won't go away. It could be 20 years postpartum and you could still have this. And this is why I said in the beginning that even if you're not pregnant or not even close to have been pregnant, it's important to note if you had this, you can still check for it, because what happens is if you leave this alone, usually right away, this isn't causing any problems, meaning the most times when people come to see me with a diastasis, it's for aesthetic reasons, because it leaves you looking like you still have that pouch in your stomach. Like the people will say, I still look like I'm pregnant, even though I had a baby 6 months ago or a year ago or 2 years ago. And that's what they're bothered by mostly. They're not usually coming because of pain at that early on. But I will tell you, it's very hard to get a strong core when your core looks like this. And therefore, with a weak core, you will probably end up at some point down the line with a back issue, with a pelvic floor issue, with any other underlying issue that weak core can cause, because the core is connected to all those other things like we showed in that picture. So when you have weakness in one, if your core is weak, then your back has to overwork and gets strained a lot easier. Okay, so every time you're bending and lifting your child or groceries or whatever, you're overusing your back muscles, leaving them very vulnerable to injury because your core was never properly addressed and strengthened in the right way. I saw a woman in the office I was working at who, she had twins, I think, but they were like 19 years old. But when I went to check, you know, she just had like chronic back issues. It just kept coming and then it'd go away and then it'd come again. And, you know, when I did all the normal kind of tests on her, everything seemed kind of fine. And then I went to check her abdominal muscles and they were still way separated. And so that was really the problem, that because she never addressed it, it reared its head many years later, but it was gradually just getting weaker and weaker. And so her back was doing too much, all those, you know, repetitive motions. So just a quick how to check for it. And this, if you really want to do it, you would have to lay down. So I'm going to describe it. And if you want to, you can do it, or you can just remember it and do it later. I'll demonstrate it though, because I am not embarrassed to do this all day. So we are on my floor.
Feel free to cover your camera, undo your camera, and I did it before.
Yeah. So what you want to do is take your fingers and put them above your belly button. Okay. And I'm trying to go so you can see. Okay. So we're right here. Okay. Right in the middle line, that central line right above your belly button. And all you do is I want you to put your fingers kind of perpendicular to that central line. And then you just lift your head and shoulders up off of the floor. Okay. And then kind of wiggle your fingers back and forth. If you can feel the muscle, it should be tightening automatically. When you lift your head and shoulders, your stomach muscle here should tighten. If you can feel it on both sides of your fingers and you can't fit your fingers in there, or it's like you can only fit one finger in there and it doesn't go very deep, meaning if I push down, I don't feel my fingers like sinking all the way down, then you're fine. Do the same thing below your belly button, because sometimes it can happen above the belly button, sometimes it can happen below the belly button, and sometimes both. If you feel like you're sinking in and your fingers just keep going, like you're going to touch your intestines soon, you probably have a diastasis. Or if you feel like you need to really move your hands side to side to finally feel that block of the muscle, then try to feel how many fingers it would take to feel both sides on both sides of your fingers, you know what I mean? And that's how wide your diastasis is. And then it's good to have that number to say, okay, you know, right now I'm like 3.5 finger wide, but as I do these exercises, it progresses and now I'm only 2 fingers, and, you know, so it's just good to have that starting point. So that's just kind of how you check if you have a diastasis, and then you can know so that you can do something about it. Okay, any questions about so far what I'm saying? No, we're good? Okay. Moving on. So I mentioned also another problem is just this pubic symphysis, and this is a really exaggerated picture. It doesn't get that separated, but just basically the pubic bone can separate a little bit, and that can cause severe pain. A word about C-sections. You know, besides for there, you know, obviously there's lifting restrictions right afterwards, and when we get to the exercise portion, everything that you can do at 6 weeks, let's say, you'd have to add 2 weeks for a C-section, meaning if it's safe to exercise at 6 weeks for a regular birth, a vaginal birth, for a C-section, you should wait till 8 weeks after. Okay, so when we get to the exercise guidelines, you're just going to add 2 weeks on to the C-section just for the like surgical precautions. And then a word about the incision. You know, the incision, if left alone, could cause adhesions, which is basically it sticks to the tissues underneath the surface. And that can be problematic. That can cause pain or issues within your organs in here. So you don't want that. So an important thing to do once the incision has healed and totally cleared, and not, no more stitches or anything like that, is scar massage. And the way you do that is you're going to work your fingers perpendicular to this. If this is the scar, you're going to put pressure with 2 fingers into the scar and then working perpendicular to it this way on the scar itself, just to help move the tissue around. And if you don't feel like you're getting it good enough, you can, a PT can do this, or anyone else is trained to do that. But it's important to, it's very important to break those adhesions up so it doesn't cause problems in the future. It's just a word about that.
Is that one of, is that, I have a question from somebody, is that one of those things that could be like years later also manifest itself?
Sometimes,
or people would know that?
Because adhesions can start, the C-section incision is very low down. And so adhesions could start to form, and then, that can get to your uterus or other things down there. And it's just not, it's not a good thing. So if it feels like, if you touch your C-section scar and it feels very hard, it's not movable, then that's not so great. That means that it has a lot of scar tissue in there. Not to say that it can't be fixed years later. It probably can, just not as well as it can be, kind of early on. But definitely you should have someone do some deep tissue scar massage on that area to break up the adhesions at that point. We good? Okay, so back to the pelvic floor, because this is really, for anyone with pelvic floor issues. This is not just postpartum, okay? I want to talk about the purpose of the pelvic floor because that will help you understand what goes wrong sometimes. This is a very simple illustration, but it is a good, I think it's an effective illustration of the pelvic floor muscle. So this is kind of looking down into the skeleton of the pelvis and what the pelvic floor muscles look like, okay? And this is just a representation of someone cut in half lengthwise and what it would look like inside their body. So this is the pelvic floor muscles, and there are a group of a few different muscles in here that make up the pelvic floor. What is the purpose of the pelvic floor? The purpose is, there's a few purposes. One, it's literally a floor, okay? We have all these organs and plus all the other organs that's going on top of here, and your intestines and your colon and all that, that it creates a floor for, okay? And without it, things would start to just descend and descend into it, okay? Gravity pulls everything down, right? So our pelvic floor is the bottom. There's nowhere else for it to go except for out these holes in the bottom of our bodies, right? So back to, I want to talk about prolapse for a second. If our pelvic floor is not nice and taut like it should be, it's getting kind of relaxed. Basically also what the pelvic floor does is it tightens around your, your urethra and your rectum and your vagina. So if it's not keeping those holes nice and closed when they should be, sometimes the organs start to descend into the openings themselves. So you can have, you can have like it's called a rectocele, or, there's different types of prolapse, but basically what it feels like for the person themselves is it feels like a heaviness, like almost like something starting to fall out, literally. And sometimes you'll feel it like day 1, 2, 3 after giving birth. You'll feel that like every time, like if you're standing up for too long, and you might remember that feeling of like, you've overdone it when you're walking, maybe you walked a little too far, you've been standing for too long, and you just start to feel that heaviness down there, like things are about to fall out of you. That's actually prolapse, okay? And that's normal first couple of days after giving birth. But if it's not those first couple of days, with any other time in your life, it is not normal and can be treated by a pelvic floor therapist. So, definitely don't ignore it. Another purpose of the pelvic floor is to tighten, like we said, to stop urine from coming out when we don't want it to come out, and gas from coming out when we don't want it to. So the problem happens when the pelvic floor is two things. One, when the pelvic floor is too weak, and so urine leaks or gas leaks when we don't want it to. And the other problem that is just as bad that people don't realize is the opposite, is when the pelvic floor is too tight, okay? And it's just kind of like holding on, and we touched on this also in the last class. If it's too tight and there's like a spasm in the pelvic floor, or it's just constantly in that contracted mode, a few things can happen. One, it can cause pain, which we talked about with the vagismus and all of that. It can cause that pain, for penetration purposes. 2, it can cause weakness. Tightness can also cause weakness because, as I explained last time, if this is your pelvic floor muscles and they're already tight, they're already here, and then you're in the car and you're an hour from home, and all of a sudden you feel like you got to go, so your pelvic floor is saying, okay, now contract really hard because we're not anywhere near home now, but we're already in this position. Where else is it going to go? There's nowhere else for it to go. So that manifests itself as a weakness. It's not allowing it to contract any tighter, right? Because it's already here. So now I can't contract anymore. And now when I'm sneezing and creating a load on, like, remember we did that cough? You feel it in your pelvic floor. If your pelvic floor is not contracting, if it's relaxed, and we have that load, all that gravity pushing down from a cough or from a sneeze or from yelling at your kid or a jump or anything like that, you'll leak because it just doesn't have, it's already so tight, it has nowhere else to go, and so you'll leak also. So sometimes people think that just because I'm leaking automatically means I have a weak pelvic floor, but sometimes that's not the case. Sometimes it's actually that your pelvic floor is too tight, and so you need to learn how to relax it a little bit better, okay? And we'll talk about it. So I just wanted to make people aware of that because they're not always, it's not always so evident. Okay, so we're all gonna do this. And the good thing is you don't have to turn off your camera because I can't see what you're doing anyways, okay? And I always say these pelvic floor exercises are so great because you can do them anywhere and nobody will know you're even doing them. So I'm gonna give you like a couple of, like a demonstration of some pelvic floor exercises that will both strengthen and fully relax your pelvic floor, okay? One word before we do that is that, just lost my chain of thought. Okay, so basically, oh, I know what I was gonna say. A lot of times, people have in their head, or they've heard, or their OB told them, or whatever it is, that if you, before giving birth, or if they're, they feel they have a little bit of incontinence, just do Kegels, right? We've all heard of Kegels. And sometimes people will come to me and say, I'm doing Kegels all day long and it's not working. And the answer is that it's not just about tightening and letting go and tightening and letting go. And, Kegels all day long, you can do them till the cows come home. But if you don't have the proper control of your pelvic floor and the proper relaxation of your pelvic floor and the use of your pelvic floor in different ways, you're not going to necessarily stop that issue that you're having. So I like to use the term pelvic floor contraction for the tightening of the pelvic floor and pelvic floor relaxation. Okay, I don't use the word Kegel so much. And in case anyone doesn't know how to feel if they're doing a pelvic floor contraction or a Kegel, try to think about, this is a little strange, but just bear with me. Try to imagine you're on the toilet, and we're all friends here now. So we're on the toilet and you want to stop urine in its track, okay? You just want to stop really quickly. That muscle that you would use to stop the urine from coming out, like midstream, those are your pelvic floor muscles, okay? The other way to think about it is like if you were pulling up, like trying to suck in, almost like pull up a tampon, okay? I don't know why you would do that, but that's the muscle that you're using. Those are the muscles that you're using. And it is, and you can see from this illustration, it is an up motion as you're pulling it up. One word about it, if you think you're doing it, but all you're doing is really like clenching your glutes, that's not necessarily it. And also you could, in order to tell, you could just put a finger on your glutes when you try to do a pelvic floor contraction. And if all you feel is tightness there, then you might not be doing it right. Also, sometimes people just hold their breath or they'll suck in their gut. That's not it either. Your glutes and your abdominal muscles are very closely related to your pelvic floor. So when you're doing a pelvic floor contraction and you feel them working as well, that's okay. But that shouldn't be the only thing you feel. So just be careful that you're not just doing that. Okay, so we're gonna do a little exercise together. I put this picture of the elevator because this is the imagery I want you to have. When we're talking about pelvic floor contraction, we talked about the different uses of the pelvic floor. And sometimes the pelvic floor has to contract really fast. And, like if we're about to sneeze or jump, And sometimes it just needs that static control, right? That hold, kind of that hold to keep everything up. And sometimes it needs to be able to relax fully. Okay, so we're going to talk about that in terms of an elevator. You see, as it's going up, it doesn't just come all the way up to the top an elevator, it goes to each floor. Okay, so everyone sit comfortably. Now I want you to imagine your pelvic floor muscles are going up an elevator ride. Okay, and it's going to stop. First is we're at the basement, right? And we're going to go up to the first floor, the second floor, the third floor, the fourth floor, and the fifth floor. And we stop at the top, okay, and hold it there. Now we're going to go down the elevator ride. We're going to go down to 4, 3, 2, 1, and basement. And the reason we go all the way down to the basement is to make sure we get that full relaxation. And the reason we go all the way up to the top is to make sure we get that full contraction, because sometimes you might think you're fully relaxed, but you're really stopped at floor 2, right? You have to get all the way down to the basement, and we have to get all the way up to the 5th floor, or as you progress in these exercises, might be the 10th floor. And you have to go all the way down. So let's do that one more time now that you know what I'm doing. Okay, so we're starting.
You know, what's the breathing for this also? What's
Good
the breathing?
Question. As we're going up, I want you to slowly exhale. Okay, and as we're going down, I want you to inhale. Okay, because that's, remember our picture here. As we're pulling up the pelvic floor, we are expelling, as the upward arrows, expelling air from our lungs with our diaphragm. And as the pelvic floor is relaxing and coming down, we're bringing air into our lungs and our diaphragm is pulling down. Okay, so that was a very good question. Thank you. So, so here we go. We're gonna go up with a slow exhale. I'll be talking, but I want you to exhale through your lips. Okay, so ready? Here we go. Up, 2, 3, 4, 5. Hold it at the top. 1, 2, 3, 4, 5. And now inhale. 1, 2, down, 3, down, 4, down, 5. You get all the way down to the basement. Did you guys feel that kind of? So, you know, it's important to feel all those different types of contractions and relaxations. And when I do, you know, real pelvic floor training with someone, we go through all these kinds of combinations and a quick contraction and a quick relax and a slower one and a faster one, so that we can kind of retrain the pelvic floor in all of its multiple uses. Okay, so that was just a little quick kind of glimpse into pelvic floor training, but I hope you get a better idea of it. Yeah.
I'm going to pre-stage. I think that you're going to talk a little bit about this, but if somebody's really missed the boat on the postpartum and you know, also with, you know, the split stomach muscles and with a weaker pelvic floor, if somebody is really in a bad situation, how much improvement can you see through PT? Sometimes people have surgery. Like, where's that line?
Good question. So I always tell people, especially with the diastasis, with the split muscles, I always kind of set the expectations with them. You know, my goal in physical therapy for someone with a diastasis is to get them functional, to get them strong, and to prevent pain. Okay. Now that might not be getting back to that 6-pack look. Okay. That might be going from 4 fingers to 2 fingers, but not so deep. It's a little more firm. There's still 2 fingers there, so you're still going to have a little bit of that pouchy look, but it's not as, you can't sink them as deep, which means our deep core muscles are working a lot stronger, and therefore they're more stable in their spine, and therefore they're preventing back pain. That's my goal. If someone really wants 100% back to that full alignment, able to get a 6-pack kind of position, that might take plastic surgery. I say might because there's always, you know, the exception to the rule, and I'm not just, you know, a lot of people I see go all the way back, and that's fine, but a lot of people don't go all the way back. They'll get a certain percentage back. Everyone will improve, but not everyone will get 100% back. Okay, so that's where surgery comes in there. In terms of pelvic floor, what I would say is, you know, I am not an internal pelvic floor therapist. I am more of like the external. We do exercises and training and bringing it into function and movement and using your pelvic floor in all the functional ways. But I am aware of when someone needs more of the internal work. So first thing I would do is send them, if someone has like a really bad prolapse, or, you know, they just can't get their incontinence under control, or they have really a lot of tightness in their pelvic floor, and no matter how many stretching exercises and relaxation exercises we do, that tightness is just not going away. That's something an internal pelvic floor therapist can really help with just like some soft tissue release work. Just like soft tissue release on your neck or your back, it's the same thing. It's all a muscle, and that could really help with that. In certain cases, you know, surgery is a lot less common for pelvic floor issues unless you have a really, really bad prolapse or something like that. But, you know, my first step would be to send them to an internal pelvic floor therapist. And then from there, you know, obviously we also always work in tandem with the OBGYN or the gynecologist. And, you know, we're always in direct contact with them and seeing what's safe and what they recommend. And then if we're saying, you know what, we've done this much and we've gotten this far, but they're just not getting where they should, then I'll send them back to the doctor and see what they recommend from there. All right. Okay. So just a quick word about when is it safe to return to exercise. So like I said, for C-section, you just want to add 2 weeks to this timeline. So it's the same type of timeline, just instead of 0 to 6 weeks, you're going to say 0 to 8 weeks. You know, again, talking about the doctors, you know, the standard line is come back to see me in 6 weeks, and then you're safe to exercise, right? If I clear you, you're safe to exercise. Question is, can you do any exercise before that 6 weeks, right? So, you know, a lot of people will just shy away from anything, and you really have to listen to your body. That's the number one rule about, you know, postpartum exercise. You have to listen to your body. You have to feel what feels okay and what feels worse, and what is causing pain and what is causing you to, you know, feel some prolapse or anything like that. But a lot of times, if you're under the guidance of a physical therapist or a fitness coach that's trained in postpartum exercise and your OB is aware of it, I've personally spoken with a few OBs who say, absolutely, you can get them working, get them started with certain, you know, gradual exercises, as long as they're under my guidance, and not just, like I said, jumping back to Zumba or CrossFit, but they're working slowly. You can start certain exercises before 6 weeks. So what are those exercises? The mobility work, just getting your, you know, your range of motion, your joints moving again. You know, walking is fine. A lot of posture awareness, breathing exercises to get that diaphragm back. Those are all fine in the first 6 weeks. After 6 weeks, we're allowed to start more of like the safe cardio zone. So what we say is between 6 weeks and 4 months, you're considered like that immediate postpartum phase. So we say try to keep it even at the end of 4 months to at most 50% of what you would be doing in a normal circumstance. So if you're a runner and you used to run on your treadmill at 6 miles an hour for 40 minutes every day, you know, I would say take it down to 3 miles an hour, you know, or 4 miles at most, and maybe work, you know, start at 10 minutes and work your way up to 30 minutes at most, you know, and for the first 4 months. You can also start doing some like the deep core exercises, because the deep core is what's going to help us bring that diastasis back. And, you know, you always want to take breaks in the very beginning. You know, everything should be gradual. That's really the key. It should be gradual, and you should be listening to your body. And you should be listening to your pelvic floor and to your diastasis. And you should feel, if I'm doing a jumping exercise, you know, at 4 months and 1 day, if I start doing running and I feel like heaviness in my pelvic floor, or I feel my abdomen splitting more, or, you know, I feel bulging, then that exercise that you're doing is probably a little too hard, and you should back up and work back up to it. Okay. So really the key is listen to your body, progress slowly, and try to maintain some of these guidelines of staying at under, you know, 50% or under for the first 4 months. And then after 4 months, just kind of progress from there as you feel comfortable with. And can you hurt yourself? You know, you certainly can if you do too much in the very early stages. And like I said, if you already have underlying issues like the diastasis or some pelvic floor weakness, and you're adding a little too much load to that, that can cause some, you know, just exacerbation of those issues. So Just be cautious, that's all. So if we're okay, I'm going to move on beyond the immediate postpartum phase and talk about what I call mommying, okay? So a lot of these issues just come up that I see women for all ages, in terms of neck pain, back pain, like we said, strains and things like that. And this is just where it's important to be aware of protecting yourself and supporting your body, and not causing, musculoskeletal issues that then come up and then I see you guys. So just a quick word about feeding, whether it's breastfeeding, bottle feeding, whatever it is, always try to give yourself enough support, external support, okay? Because, especially in the very beginning, we are feeding that child a lot of hours of the day. It's like most of your day is just feeding, or leading up to feeding, or preparing for feeding, or whatever it is. So you want to make sure if you're in one position for many, many, many hours of the day, you want to make sure that that position is well supported and not causing stress to your body. So this is a really great example. You want to always have a pillow or support under the baby to lift the baby up to you, so that you're not bending down. Like this woman is kind of hunching over a little bit, bending down to the baby. So she's going to definitely have some neck pain here, probably some upper back pain after that feed. It's good that she has the pillow here, but this is better where you have external support behind your back, under your elbows. And again, you want to always make your feet flat on a surface. So she's sitting all the way back in the chair, which is the best way to be. But when she does that, her feet are probably dangling. So it's best to put a little stool or a book under your feet so that everything can be fully supported. And then again, this woman, okay, except you see her shoulders are starting to hunch up a little bit because she doesn't have enough support under her elbows or right behind her back. There's probably not really anything under this kid's head. So best thing to do is set yourself up, after the last feed, just set up your little station for the next feed so that when the baby's crying and screaming, you're all set up and ready to go for the next one. A word about baby carrying is great if you like it. It, a lot of times can save your shoulders or your neck. Oops. But I would definitely recommend the thing to keep in mind about baby wearing is you want to distribute the weight as evenly as possible throughout larger parts of your body. So this is really not so great because she, is going to end up shifting over and causing a lot of shearing on her low back to that side. These are great. These wraps are great because, again, it's distributing more weight through more parts of the body, and the way she has it kind of fanned out like that is really good. The baby Bjorn type things are great, especially when they have that extra thoracic strap, because again, we're evening out the weight over more parts of the body. So the wider the straps and the more support you have in other parts of the body than just one shoulder, the better. And then this is just a quick reminder, please don't carry the car seats on your elbow. I seen a woman who actually had to have surgery on her elbow because she carried her car seat like this for so long. It is really heavy. There's no way around those things. They're really heavy. Just, as much as you can, try not to carry it too much. But if you have to carry it, hold it in two hands like we practiced last time. Hold it close to your body and, try to do good posture, good body mechanics, do those good squats if you have to bend down to pick it up from the floor. And, just be really close to the car when you're taking it out, go right into the snap and go or whatever you're putting it into. Try not to twist, but try to actually turn your feet when you're putting it down, because those things, they're very heavy. There's no way around that. But yeah, this is not so great. She did like a little thing to kind of give herself a little more support. I don't love it either, but at least it's better than this. So I just wanted to bring some visuals there. Okay. Any questions about babies and pregnancy and immediate postpartum, that kind of stuff? No, we're good?
A little bit, but we'll do at the end because I want to make sure we're
Sure.
a little bit out of time. So
sorry. Oh, I'm sorry. Okay, we're almost done. So we skipped ahead a couple of decades, but I just want to talk quickly about bone density and osteoporosis. So bone is a living tissue. We think of it as just like this solid rock, but it's not. It's actually constantly changing and remodeling itself. Bone mass is how much of bone tissue is in the body. We reach a peak of bone mass density at age 30, okay? Remember we talked about in the like puberty section, that's when we have a very big kind of boom of bone mass increase. And so that keeps increasing and increasing and increasing until we each reach age 30. And this is actually a very interesting fact that let's say, I don't know the exact numbers, but let's say you have a bone mass of 100. I'm totally making up these numbers. Let's say you have a bone mass density of 100 at age 30, and you were not an exercise person, versus someone who did regular exercise. They found that people who did regular exercises at a younger age reached a higher peak when they got to that age 30. So, it's obviously better to start from, a fuller basket. And if you're going to go downhill from there, than to, start at a lower number and go down from there. So that's just kind of a plug for regular exercises at younger ages and beyond, obviously, which we'll get to. From age 30 to menopause, there's very small to no change. So you're not going up in bone mass density, but you're also not going down at that point. And then for the first few years post-menopause, there's a rapid bone density loss. And that's again due to the estrogen decrease that we talked about with the puberty section, that the estrogen increases bone mass density. And so when we have a rapid loss of estrogen in menopause, that causes a rapid bone density loss as well. So after the first few years, that rapid decline starts to slow, but then it does continue to decrease as we age. So again, this is just something women have to be very conscious of. And I know that most women get, bone density tests regularly by their gynecologists after a certain age. And the reason we do that is because if you have low bone density, it can lead to osteoporosis. Osteoporosis is just basically when we don't have a higher volume of bone tissue, it just leaves these kind of pockets, more porous bone, like it's like more holes in your bone, and therefore they're more brittle and more prone to fractures. And not only that, but once they fracture, unfortunately, they don't heal as well as a normal bone would heal. So what could we do about it? Research shows that the best activities to promote bone mass and prevent bone loss is weight-bearing exercises and weight training. So what are weight-bearing exercises? Weight-bearing exercises are any exercise that actually put pressure through your joints, okay? So walking, hiking, using stairs, dancing, using weights, right? Weights put extra pressure through your joints in your upper arms. Using TheraBands, resistance weight, resistance training, all that kind of increase in pressure through your joints help to prevent bone density loss. So the recommendation is to weight train or some kind of strength training 2 to 3 times per week, and alternate that with some, cardio like walking or, things like that. Another thing, just in terms of prevention, because we said that fractures are more likely and fractures heal worse. Another important thing to do with aging adults is balance training, which is also something PTs do a lot. There are exercises to help your balance and to help prevent balance loss. And that in turn prevents falls and fractures. The other side of this is our muscle mass also starts to decrease, unfortunately, as we age. And by the age 70, we only have about 50 to 55% of our muscle mass left. So that can lead to extra feelings of fatigue and of weakness, and again, just leaving everything also a little bit more vulnerable. So the takeaway here is don't stop exercising, because you need, especially if you have weaker bones, and now our muscles are also starting to get a little bit weaker, we need to combat that by constantly strengthening our muscles, doing some weight bearing. It's not just about, it's great to walk some people say, well, I walk every day 2 miles. That's great. and that's wonderful. And cardiovascularly, that's wonderful. But we don't want to forget the strength training also, especially for this age group, which sometimes happens. Okay, so you want to keep doing, and there's lots of simpler exercises that can be done that do involve weight training or therabands or, you know, gentle strength training. So don't shy away from those things. And these are just kind of common issues or, you know, diagnoses that I see in this age bracket. Our discs do start to get thinner. They actually dehydrate, so they get thinner, and then that causes compression of the vertebrae on top of each other. And so, you know, that can cause some pain in terms of back pain. And the treatment for that is core and back strengthening and back mobility training, because again, if our discs are getting flatter and our backs are getting a little bit weaker, in order to combat that, we want our core to be stronger and our back muscles to get stronger. Spinal stenosis is just when the space between the vertebrae starts to narrow, and then that can pinch on your nerves. So the treatment for that is actually being in more of a flexed posture with certain exercises, which is like a bent posture, but not staying in that position, but doing exercises that promote that in order to open up the spaces between your bone again. Osteoarthritis is basically just when the surface of your bones within a joint start to get less smooth, like the cartilage starts to, again, dehydrate or disintegrate, and then the bones are a little more jagged, and then that can rub against each other and cause pain or tear in your ligaments or in your meniscus in your knee. So again, as PTs, you know, a lot of times, I've heard my grandmother say this a lot of times, like, oh, what's the point of going to physical therapy? You can't undo arthritis. And that's true. I can't reach inside your body and replace all of your bones with smoother edges and things like that. However, exercise actually causes increase in lubrication of the joints. So that will cause a decrease in symptoms. And the other thing is exercise helps arthritis because, again, muscles surround your bones and your joints. If we have a better foundation around the joint by increasing the muscle mass above and below the joint, then that causes decrease of aggravation because they're a little bit more supported from above and beyond. If this is above and below, if this is your knee, so this is a little stronger, so it's not going to be rubbing against each other as much. So that's where exercise and physical therapy comes in. And then there's also, you know, a lot of good injection options for arthritic joints as well. That's more of a like a orthopedic realm. So just very in general, when you have any of these types of issues, let's go here first. Who can you see, right? So don't ignore pain. That's number one. Your body is telling you something's going on. Don't put yourself last. Don't ignore it for very long. Don't say it's just going to go away if it's not going away. You can see an orthopedist, your OBGYN, obviously, a physical therapist. And then there's all these other, you know, I don't put, if someone tells me like, oh, should I try acupuncture? Should I try dry needling? Should I try muscle energy techniques? Or, you know, there's other types of treatments out there, Feldenkrais, all this stuff. I don't personally have good firsthand knowledge of that stuff, but I always tell people, if it helps you, go for it. You know, I am always a team, you know, it's all about a team work, and whoever could help you with your pain, you should do it and you should feel good about it. Red flags, things that you definitely should not ignore if they're happening to you for different variety of reasons. If you have constant non-changing pain, meaning if you, you know, sometimes you have back pain and you know that it's muscular because it hurts more when I bend, or it hurts more when I stand straight, or when I walk too long. But this is a type of pain that no matter what position you're in, no matter what you're doing, laying down, standing up, sleeping, walking, whatever it is, it does not change. It stays the same. That's sometimes a red flag for something else, more organ, something, you know, systemic or internal that you should go to a regular medical doctor for. If you have a sudden unexplained weight loss, you know, sometimes we got to check that. That sometimes could be a red flag for certain cancers. So obviously, you know, speak to your medical doctor about that. Same thing about night sweats, if it's not related to, you know, menopause or something like that, or pregnancy. definitely, mention that to your medical doctor. If you hurt a limb or something like that and you cannot bear weight on it, it might be indicative of a fracture. Go to an orthopedist. Or if you have unexplained swelling or swelling that won't go away, always see a doctor about it, or any kind of trained professional, because swelling is the body's reaction to injury. So there's obviously something going on in there. Okay. So in conclusion, I know this has been really long and I'm sorry for going late, but move smart. Okay. Think about mindful movements. Always check your posture. Always see, where's my head? Where's my back? Where's my shoulders? Where are my ears? Keep a strong core, because the core really supports all of your body. Definitely stay active and never ignore pain. Okay. I hope you guys enjoyed this as much as I did. And if you have any questions, I am here. Feel free to exit if you don't have questions. Thank you for your time, and I hope to speak to you soon.
Thanks. I'm going to jump in for a second. Thank you so much, Deena.
Absolutely.
A couple of really, thank you so much for your time, Deena. This was like so amazing. And there are a couple questions afterwards that I'm going to like throw out so you could stay on or not. I just wanted to point out, next week we're going to be having our third session where we'll talk about the interface between some of these issues and things that I see as from a Yoetzet perspective, from an emotional perspective, sometimes halachic perspective. We'll also we'll also have a local professional who does deal with the deep pelvic floor things probably join us, or is available for some questions. We'll get that information out. And thank you really so much, Deena, for your time. That was super professional.
You're welcome.
I'm going to just throw out some questions that I've been getting, so
sure.
Feel free. Okay, first of all, in terms of if like all those things to do in order not to hurt our back, like holding things close to us and squatting, if you have a knee injury and you can't squat, is there something else that you could do that helps?
That's a very good question. You could always, there's different positions for a squat. Like some of those pictures, certain like a lunge position where one leg can stay straight and one leg could bend, but you're still keeping your back kind of straight. You can do that. The other thing you can do is remember we talked about that hip hinge where you're keeping your chest up, right? I'll do it one more time just to remind everyone. You're keeping your chest up, your core is tight, and you're literally just hinging straight from your hips. Okay, so I'm not bending my knees at all for this one, but I'm still protecting my back because I'm keeping my core tight, and I'm not bending at the back and I'm not arching at the back. I'm just keeping it neutral, and then I'm just using my hips and my glutes to lift something up like that. You can also do that.
Great. Also, if like some of these things that can be supported by an external measure, like a knee brace or one of those back positioning things that pull your shoulder back, what's your feeling about those? Like sometimes people might think that promotes muscle weakness because you're adding something to the body, or like what's that balance between working on that underlying muscle structure versus a thing?
Yeah, so that also comes in with sometimes like the pelvic girdle pain, sometimes, or the diastasis, right? When people have like a really bad separation in their muscles, they'll get one of those binders or support belts to help kind of hold everything in. I am all for them for a certain time period, meaning immediately in the beginning. First of all, if you're having like a knee issue and your orthopedist prescribes that, then you should listen to the orthopedist because they are more, of the authority on that. But if it's more of just like you said, the back positioning things, or if it's like the belly binder type things, or a support belt for your SI joint, your low back and your pelvis. What I would say about those are, if it's immediately postpartum, especially women who had a really bad separation, or let's say had twins, so they were very, very, very stretched out, and they like can't even stand up straight because they just feel like everything's falling out, or their back hurts so much because of it. I recommend using them for like the immediate postpartum phase, but with an asterisk saying, and the same thing for your posture. If you're having so much pain, in your neck or your back or something, that every time you do this, it's really hurting you so much that it's impeding in your function, I would say use it, to be able to be functional in that, early time period. But immediately once you can start strengthening and doing the exercises that you need to get the muscles to work properly, definitely start weaning that brace down as much as possible. Because like you said, you don't want your body, basically the brace is doing the work for your muscles. So it's good to keep it in that position. If you need to be working on your computer for 6 hours straight, and it's better than punching, but at the same time, you want to wean off of it as early as possible once you start strengthening those upper back muscles and the shoulder blade muscles, so that you can learn how to regain the strength on your own. Does that make sense?
Yeah, and actually it's actually interesting. Like 3 different people asked regarding different exercises. How much do you think after you do for the various things that you mentioned, like if you have a real issue that you fix with PT or with exercises, then how much maintenance do you have to do? Like sometimes, like once it's fixed,
right,
do you find that real like ongoing PT or ongoing exercising, obviously you have to exercise, but will it kind of revert back, or once most things, once you get them to
it's a really good question. There's not a very good answer to that. I would say that obviously it depends what was wrong. It depends what, if you had surgery on your knee, you tore your ACL, you had surgery on your knee, or you broke your leg or whatever it is, and then you're doing these exercises as rehab. Once the injury is healed, you don't have to do straight leg raises all day because that is healed and you're able to walk. Okay. So that's a little bit different as opposed to someone who has like chronic back pain or, like chronic issues like that just keep like popping up and coming down and popping up and coming down. That kind of person, I would say, should always be incorporating deep core exercises, which are different than just crunches. That's not what I'm talking about. I'm talking about like activating, remember with the TAs that we did last time, contracting those TAs and then doing different types of movements with your legs or with your arms to get the deep core muscles stronger, because those are your stabilizing muscles. And so the stronger, the more you maintain that strength, the more you'll just always have that like nice stabilization of your spine to prevent injury, re-injury of your back. So those are more ongoing, I would say, or just like something you should incorporate into your regular exercise routine. Like do switch off days of cardio and then you do core another day, or, something like that.
And a question about aging, that once these, like you talked a few different times about like losing muscle mass and losing the bone, and your grandmother was like, "Why with the arthritis? Like, once it's terrible, what am I supposed to do anyway?" Do you find that people, if they really work hard, can not just function, they could regain some of that muscle mass? Is it really just about stopping the degeneration, or do people really see improvement?
Unfortunately, I don't think I'm not, I'm not 100% sure. I don't want to give 100% answer on that, but someone like an endocrinologist might have a better idea about that. But I don't think that you can get back, like, let's say, your peak number, whatever it was, I don't think you're going to get higher than that. You might just like stop it from going lower and lower and lower. You know what I mean? So you'll stay at a certain level as opposed, so you're preventing it from getting lower. I don't know if you can actually build, you know what, I think the weight bearing exercises does help to regain some of it, but you're probably not going to get to that peak number again.
Right, not when you were 40, but you could still regain and also function. You could see improvement in function.
Exactly, and in symptoms and in prevention of fractures and things like that. So it's about percentages, meaning you'll gain back a certain percent, but you'll never get back to that like peak that you were at 40, but you might get 20% better or 10% better.
Great. If I have not hit your question, then you could chat it now or raise your hand really strongly.